Good afternoon. I'm Myron Douglas, a health communications specialist with the Division of Environmental Health Science and Practice in the National Center for Environmental Health and at the Centers for Disease Control and Prevention. I'd like to welcome you to today's EH Nexus webinar entitled All Children Can Be Exposed to Lead, CDC's Efforts to Promote Awareness and Testing. This presentation is being brought to you in recognition of National Lead Poisoning Prevention Week. Closed captions are available for this webinar. Next slide, please. Today's webinar is being recorded and will be available online in a few days. You can find this video recording at the web page link displayed on the slide or by scanning the QR code on your screen. Next slide, please. All participants joining us today are in listen-only mode. You may submit your questions at any time during today's presentation. To ask a question using Zoom, click the Q&A button at the bottom of your screen and then type your question in the Q&A box. Please note, we often receive questions during the webinar we aren't able to answer due to time constraints. If your question is not answered live, you can also submit your question at ehnexus@cdc.gov. Next slide, please. And we are pleased to have with us today Dr. Perri Ruckart and Ms. Madeline Jones. They are members of the Program Development, Communications, and Evaluation team in CDC's Lead Poisoning Prevention and Services branch, where Dr. Ruckart is the team lead and Madeline Jones is an ORISE Health Communications Fellow. I will now turn the floor over to Madeline Jones. Ms. Jones, you now have the floor.
Yeah, thank you, Myron. And good afternoon, everyone. Thank you for taking the time to join us. My name is Madeline Jones, and I am a Health Communication Fellow working with CDC's Lead Poisoning Prevention and Surveillance branch. Next slide, please. So today we're going to talk about how children can be exposed to lead and then also how it can be prevented. So after this presentation, we hope that will increase your awareness of CDC's Childhood Lead Poisoning Prevention Program, the sources, routes of exposure, and health effects of lead exposure, which populations are at a greater risk for lead exposure, children's blood lead levels in the United States, tangible ways to prevent children from being exposed to lead, and the importance of blood lead testing, as well as CDC's efforts to increase this nationwide. Next slide, please. So to start, I'm going to give a little background information on CDC's Childhood Lead Poisoning Prevention Program. So our program's vision is to eliminate childhood lead poisoning as a public health problem. And then our mission is to reduce blood lead levels in children and differences in average risk based on race and socioeconomic status. Next slide, please. Our program's activities focus on strengthening 4 core strategies, and these include blood lead testing and reporting, surveillance of child blood lead levels, targeted population-based interventions, linkages of lead-exposed children to recommended services. Next slide, please. So we support lead poisoning prevention activities nationwide. And then to do that, our program focuses on supporting state and local health departments in childhood lead poisoning prevention, educating key audiences, conducting research, providing technical assistance to other agencies and partners, and supporting state and local public health programs. And on the slide, you'll see a map, and this shows all the state and local public health agencies that we currently support. There are 62 state and local governments that we support, and this is our most expansive funding package yet, which is very exciting. Next slide, please. So now I'm going to transition to talk about the issue of childhood lead exposure. So to start, I'll just start by answering the question, what is lead exposure? So lead itself is a toxic, poisonous metal. And then lead exposure occurs when a child or an adult comes in contact with lead or lead dust, either by swallowing it or breathing it in. And we'll get more into where that lead comes from later in this presentation. But exposure to lead can negatively affect normal body functions when it enters the bloodstream, and even low levels of lead can harm children's health. Next slide, please. So the nervous system is the most sensitive organ system when it comes to lead exposure in children. These neurological effects are of greatest concern for infants and children because it can result in lifelong declines in brain function. So some well-documented effects of childhood lead exposure include damage to the brain and nervous system, slowed growth and development, learning and behavior problems, and hearing and speech problems. And over time, these effects can cause learning difficulties, decreased ability to pay attention, and underperformance in school. And then childhood lead poisoning can also cause health problems in adulthood. Some of these include hypertension, kidney problems, and reproductive problems. Next slide, please. So as I mentioned, lead exposure is especially a concern for children. The effects of lead exposure are more harmful to younger children than older children and adults because their bodies are still developing and they are growing so quickly. And as children are growing so rapidly, they absorb more lead per body size than, say, an older child or an adult. And also, in addition to that, young children are more likely to be exposed to lead because of behavioral factors such as mouthing and crawling. So for example, a young child may tend to put their hands or other objects in their mouth, which could be contaminated with lead dust. Next slide, please. So in the United States, children are mainly exposed to lead from lead-based paint, contaminated soil, and contaminated drinking water. So lead-based paint was banned for residential use in 1978, and most homes built before this time likely still have some lead paint in them. And when this paint peels and cracks, it makes lead paint chips and dust that resembles kind of the image that's on the slide right now. And children can be exposed to lead when they swallow or breathe them in. And children can also be exposed to lead by touching, breathing, or playing in soil that is contaminated with lead, or when it's brought inside from things like shoes or clothes. Soil is usually contaminated with lead from deteriorated exterior paint, lead-based paint, that falls onto the surrounding soil around homes or buildings that were built before 1978. It can also be contaminated from industrial sources or car exhaust when near busy roads and highways. And lastly, some water pipes, faucets, and plumbing fixtures can contain lead, which can get into the drinking water. And children can be exposed to lead by drinking this water that has been delivered through these plumbing materials, or by drinking formula that has been made with water that contains lead. Next slide, please. In addition to these main sources of lead, there are other sources that exist that can be harmful to children. So these include take-home lead exposure from a parent or caregiver who is exposed to lead at work or through a hobby that they engage in. Some traditional medicines and cosmetics when given to the child or used by a parent or someone they spend time with. Some candy and candy wrappers, some toys, some jewelry, antiques, and collectible items, and ceramic pottery dishes that are glazed with lead. So with pottery, lead exposure occurs when the food is prepared in these dishes. The lead glaze is more often found on items that were imported from other countries or are decorated with orange, red, or yellow color, as lead is sometimes used as a pigmenting agent for these colors in particular. Next slide, please. So as I mentioned, children are mainly exposed to lead by swallowing or breathing in lead dust. So this can happen when a child comes in contact with paint chips or dust from lead paint in buildings and homes that may have landed on windowsills, the floor, trinkets and toys, or their fingers. Children may also swallow or inhale this lead dust when they put their hands or these objects in their mouth as a part of their normal development. Exposure through the skin is less common, and lead is quickly absorbed into the bloodstream. Next slide, please. So once a child swallows or breathes in lead, their blood lead level rises. And once a child's exposure to lead stops, the amount of lead in their blood will decrease gradually. The child's body will release some of this lead through urine, sweat, and feces. Not all children will handle lead the same. Many things affect how a child's body will handle exposure to lead, and some of these factors are the child's age, their nutritional status, what source of lead they were exposed to, and the length of time they were exposed, and the presence of other underlying health conditions. Next slide, please. So now I'm going to transition to talk about some current trends in childhood lead exposure. So as you can see depicted on this graph, blood lead levels among US children have declined over the past few decades. The data on this graph is actually from a publication that was co-authored by one of our colleagues at CDC. And in this publication, they analyzed NHANES blood lead level data from 1976 to 2016. And in this analysis, they found that both the average blood lead level and the estimated prevalence of US children with blood lead levels above 5 micrograms per deciliter had declined substantially between 1976 and 2016. So for example, during the 1976 to 1980 NHANES cycle, it was calculated that about 99.8% of children in the US ages 1 through 5 had a blood lead level that was above 5 micrograms per deciliter. But fast forward to the 2011 through 2016 NHANES cycle, that prevalence decreased to only 1.3%. So this decline is a huge public health accomplishment and demonstrates the success of public health and policy interventions aimed at protecting children from lead exposure, like removing lead from gas and banning lead-based paint. Next slide, please. But despite the progress made in reducing child blood levels in the US, there is still room for improvement. So although far fewer US children are exposed to lead hazards now than they were 40 years ago, the remaining children affected by lead exposure are not randomly dispersed throughout the population. They are primarily concentrated in neighborhoods that are characterized by older homes built before 1978 when lead paint was banned for residential use. Also characterized by lower family incomes, lower housing values, higher population densities, higher proportions of rental properties, and higher proportions of residents who are minorities, immigrants, and refugees. And then also higher blood lead levels are more prevalent among children from racial and ethnic minority groups, as well as children from low-income households and children who live in housing built before 1978. Then also children from racial and ethnic minority groups are more likely to live in conditions where lead exposure is more likely, like poor housing conditions and environmental exposures such as lead in air, soil, and water. Next slide, please. So as mentioned, despite these monumental achievements in reducing children's exposure to lead in the US, there is still more work to do. Millions of kids are still exposed to lead in their environments, and adverse health and developmental effects are being identified at increasingly lower blood lead levels. So even though the average blood lead level for US children has decreased over time, we're finding out that lower blood lead levels can still be harmful to children. And then also children can be exposed to lead from multiple sources. So in addition to the sources that public health interventions have made an effort to eliminate, like paint and gasoline, we're finding out that children can be exposed to lead from several other sources where they live, learn, and play, which we will get into more later in this presentation. Next slide, please. So now to give all of this information a little more context, I'm going to go over a few real-world examples of situations where children have been exposed to lead that were reported to CDC. So after I go over each of these examples, we will discuss how these scenarios can be prevented. Next slide, please. So this first case study is about childhood lead exposure from lead-contaminated soil. So lead-contaminated soil continues to be a hazardous source of lead exposure for young children in the US. It can be contaminated with lead from exterior lead-based paint that flakes off into the surrounding soil near homes and buildings that were built before 1978. And it also comes from leaded gasoline and industrial sources. So in this instance, the inquirer, her name was Carla, her son had been diagnosed with a blood lead level of 11 micrograms per deciliter. And for context, CDC recommends follow-up action for children with a blood lead level above 3.5 micrograms per deciliter. And Carla could not pinpoint the source of lead exposure to her son, but it turned out her son was being repeatedly exposed to small amounts of lead in the soil surrounding their home, and it was enough to poison him. Next slide, please. So on this slide is a quote from Carla describing her experience. So it reads, the house was recently painted and there were no obvious lead hazards. There were some small bare soil areas in which my son would play, but nothing too overwhelming. I had my soil tested and the samples came back less than 400 ppm, the standard for child's outdoor play area. But a child like my son, who eats dirt and puts everything in his mouth, was exposed repeatedly to low levels of lead, which can build up in his body. Next slide, please. So the second situation occurred after a family who was living in an older home had their windows replaced. So the inquirer, her name was Colleen, her family had hired a company to replace windows in her house, and her family, including her two very young children, returned after the window replacement occurred. They returned to find several leftover paint chips in and around their house, and Colleen knew that there was lead paint in her house because it was built in 1924. Next slide, please. So on this slide is a quote from Colleen describing her experience, and it says, the company that did our windows took zero precaution for lead and didn't give us the handout for lead levels in children. I called our pediatrician immediately. They took blood samples from the kids and advised us to get out of the house until the lead risk was gone. Next slide, please. In this final example, an inquirer reached out to CDC with concerns after his kitchen was renovated. The inquirer did not specify, but it was likely he lived in an older house where there was lead-based paint. So the inquirer wrote, he said, we had a full kitchen renovation done that resulted in lead dust. I'm concerned about my daughter's lead level test due to any possible intake. And in the inquiry, John, the name of the inquirer, mentioned that his daughter received a blood lead test, and it did reveal that she had lead in her blood. Next slide, please. And then one way children can be exposed to lead is through consumer products such as toys, furniture, food, clothing, and other things. So products sold in the United States, some of them intended for use by children, are often recalled for containing lead and presenting a health hazard for children. So to close out this section, I'm just going to go over a few products that were sold in the US that have recently been recalled for containing lead. So on your left, you'll see there's a photograph of a 1.5 ounce package of Saladitos salted dried plums, which were recalled by their manufacturer named Candies Tolteca of Fresno, California. And this happened in February. So these products were recalled for possible lead content, and the products were sold or distributed throughout California, Nevada, and Utah. And then on the right is a picture of a children's chair and desk that was made by the company Times Tienda. And these products were found to have surface paint on the desks and chairs that contained levels of lead that exceeded the federal lead paint ban. The desks and chairs also failed to comply with the federal lead content ban. Next slide, please. And then pictured here on your left, in July, the company called Brandstorm Incorporated announced its voluntary recall of their organic freeze-dried blueberry pouches because of the possible presence of lead at a level that was above the FDA's recommended limits per serving size. So the company didn't disclose how lead might have come into contact with the berries in this situation, but in past cases of similar contamination, lead contamination usually occurred either in the environment where the food is grown or the facilities involved in packaging, shipping, and processing. And then lastly, pictured on your right, in early September, children's sandals made by the company called Colon were recalled for containing lead levels in the inner layer of the sandal that exceeded the federal lead content ban, similar to the kids' tables and chairs pictured on the previous slide. Next slide, please. Yeah, so now I'm going to hand it over to my colleague Perri to discuss ways that children can be protected from lead exposure.
Thanks, Madeline. So I'm going to start off by telling you about the many things you can do to protect your family from lead exposure and what steps you can take to prevent children from coming into contact with lead. Next slide. Thanks. So identifying and addressing lead hazards in your home is one of the first steps you can take to prevent childhood lead exposure. If you live in a home built before 1978, we encourage you to have your home checked by a licensed lead inspector. Information on how to find one is available on our website in the Lead and Paint webpage, which will also be linked at the end of this presentation. And if you rent, ask your landlord to have your home checked. Children can also be exposed to lead via their drinking water from lead pipes, faucets, and plumbing fixtures. The best way to know your risk of exposure is to find out if there's lead in your home's service lines or plumbing. Your local water authority can help you determine if you have lead plumbing connected to your home, and they can help you with testing your water for lead. And if there is lead in your tap water, they can help you take steps to reduce or eliminate exposure. As we heard in the previous case studies, home repairs and renovations in homes built before 1978, such as window replacements and kitchen renovations, can release lead dust that children can easily be exposed to. If you're planning renovations, use only approved methods for removing lead hazards from your home, and use contractors certified by the Environmental Protection Agency, or EPA. Information about lead-safe renovation and repair practices and resources for finding an EPA certified contractor will be linked at the end of this presentation. Next. Thanks. It's also important to make sure your child does not have access to any products that contain lead. Some toys, especially those that are imported or antiques and toy jewelry, may contain lead. And although lead paint is banned for use on products marketed to children, as well as on dishes or cookware in the US, it is still widely used in other countries. And toys made before the ban on lead paint in 1978, such as antiques and collectibles, may also contain lead. It's important to be safe in the kitchen. Lead may get into foods or liquids prepared or stored in cookware or dishes containing lead. Some imported or antique ceramics and pottery dishes are glazed with lead. And some aluminum cookpots and pressure cookers may also contain lead. Recently, aluminum cookware brought from Afghanistan into the United States by resettled families has been found to contain lead. And children have been exposed to lead by eating food prepared or stored in these containers. It's also important to avoid using traditional medicines such as Azarcon, Greta, and Pelua, and cosmetics such as Kohl and Sindor that contain lead. If you're not sure if a product contains lead, do not allow your child to use it. And avoid eating spices, candies, and other foods that were purchased abroad from informal or unregulated sources. Foods that were produced following proper licensing and regulations are more likely to be lead safe for children. Next slide, please. There are simple everyday steps you can take to stay healthy and protect children from being exposed to lead. One of them is giving your child healthy foods. A balanced diet with foods that provide calcium, iron, and vitamin C may help keep lead out of the child's body. Many of these foods can be bought with food vouchers from food assistance programs. Make sure that the child washes his or her hands and face after playing outside or with pets that it might have lead particles from soil on their fur or paws. Regularly washing children's toys, which might become contaminated from lead and soil or household dust, is also recommended. And removing shoes when you enter the house helps to prevent spreading lead-contaminated dust through the home. Be safe when working with lead or engaging in hobbies that involve lead. If you or someone who lives with you works with lead or engages in activities involving lead, have them change into clean clothing before coming home. Keep their work or activity shoes and tools outside and wash their clothes separately from the rest of the family's clothes. Next, please. Now I'm going to discuss testing children for lead exposure. Next. If you think your child may have been exposed to lead, talk to your healthcare provider about getting a blood lead test for your child. Children who have been exposed to lead often have no apparent symptoms. A blood lead test is the best way to determine if your child has been exposed to lead. And the amount of lead in blood is referred to as the blood lead level, and it's measured in micrograms of lead per deciliter of blood. Blood lead levels in children can easily be determined by a blood test. And during a blood test, a small amount of blood is taken from the finger, heel, or arm and tested for lead. Two types of blood samples or collections may be used. A finger or heel prick, known as a capillary sample, is usually the first step to determine if a child has lead in their blood. A finger prick sample that shows a blood lead level at or above CDC or the state's blood lead reference value is usually followed by a second blood collection to confirm. And a venous blood draw takes blood from the child's vein. This type of sample can take a few days to receive results, and it is the best type of blood sample to confirm the levels seen in an initial capillary sample. Next slide, please. Based on the test results, healthcare providers can recommend follow-up actions and care. A clinician may provide education on the sources of lead and ways to prevent exposure, monitor the child's growth and development, assess the child's symptoms, refer the family for lead inspection and removal services, or initiate medical treatment. CDC provides recommended actions based on blood lead levels, and these are listed on our CDC Childhood Lead Poisoning Prevention website in the Resources for Clinicians section. And it is up to the provider to decide how to treat children with lead in their blood in conjunction with state and local requirements. Next, please. Blood lead testing for children in the United States has declined over the past few years for several reasons, and one contributing factor has been device shortages. And in January of this year, the Food and Drug Administration updated the device shortage list to include all blood specimen collection tubes. This shortage may impact blood lead testing among children. CDC provided recommendations to our partners for ways to ensure children continue to receive accurate and timely blood lead tests, including conservation strategies for test tubes. Next, please. Declining rates of blood lead testing among U.S. children presents an emerging public health issue that CDC is working to address. According to a recent report, 30% of children enrolled in Medicaid did not get tested at required intervals, and there tended to be a drop-off in testing between ages 12 and 24 months. Additionally, over 1 in 5 children enrolled in Medicaid did not get tested by age 3 years. The Centers for Medicare and Medicaid Services, or CMS, requires lead testing at 12 and 24 months for the recipients. And this disparity, along with the recent device shortages and the pandemic, have caused a decline in blood lead testing. So CDC is undertaking several initiatives that we believe will have a positive impact on testing rates. And these include last October in 2021, we lowered the blood lead reference value, or BLRV, and I'll discuss this more in the next slides. We're pursuing improvements in CDC's surveillance system and methods to improve data quality and reportability. These include a soon-to-be implemented feed of blood lead levels to the Environmental Health Tracking Portal and training to funded programs on continuous improvement of surveillance and reporting processes. We have plans to publish new online training modules, which will be available on demand. They'll cover a variety of topics and be presented from over 20 subject matter experts in the field. We've also created case vignettes based on real-world inquiries received by CDC to highlight lesser-known ways that children are exposed to lead, and Madeline had just presented a few of those to you. We're expanding outreach to healthcare providers by running ads in Medscape that encourage providers to test at-risk children. We're collaborating with state Medicaid directors, proposing additions to the Medicaid core set for 2023, engaging with pediatric environmental health specialty units, or PACUs, poison control centers, nursing practitioners associations, and others. And this would include the Council of State and Territorial Epidemiologists, or CSTE. And we work with them to update their position statement for childhood lead poisoning, which is used by CDC's National Notifiable Diseases Surveillance System, or NNDSS. And we're planning to release the LERI, the Lead Exposure Risk Index, later this year. And this is a new tool to help identify and map community risk for lead exposure. Next slide. So CDC has been involved in defining the criteria to interpret blood lead levels in children since the 1970s. And over time, scientific evidence emerged showing that even low levels of lead cause negative health impacts. And additionally, no safe blood lead level in children has been identified. In 2012, CDC established a population-based blood lead reference value, or BLRV. The BLRV is based on the 97.5th percentile of the blood lead distribution in U.S. children ages 1 to 5 years from data collected by the National Health and Nutrition Examination Survey, or NHANES. And it was initially set at 5 micrograms per deciliter in 2012 based on NHANES data from 2007 to 2010. And it was updated last October to 3.5 micrograms per deciliter based on NHANES data from 2015 to 2018. The BLRV is not a health-based standard or toxicity threshold. Updating the blood lead reference value allows CDC, federal partners, and health departments to focus resources on children with higher levels of lead in their blood compared to most children. It also supports CDC and the administration's commitment to health equity and addressing environmental justice. And as discussed earlier, there are significant disparities in exposure and health outcomes by race, ethnicity, and socioeconomic status. I want to point out that CDC no longer uses the term elevated blood lead level. And in July 2022, CSTE changed the name of the condition under surveillance from elevated blood lead level to lead in blood, and updated the criteria for reporting, the case definition, and case classifications. Next slide, please. Since 1997, CDC has recommended targeted lead testing for U.S. children. And as I previously mentioned, CMS requires all children enrolled in Medicaid to get tested for lead at ages 12 and 24 months, or between ages 24 to 72 months if they had not previously been tested. For children not enrolled in Medicaid, CDC recommends focusing testing efforts on high-risk neighborhoods and children by identifying those at risk for lead poisoning based on age of housing and sociodemographic risk factors. Public health personnel and healthcare workers should use local data to develop testing plans that are responsive to local conditions. But in the absence of such plans, CDC recommends universal blood lead testing. But another testing strategy implemented in some states is universal testing. They don't practice the targeted testing. And with this strategy, all children are required to receive blood lead tests at specified ages, regardless of assessed risk. This strategy has been shown to be successful in increasing blood lead testing rates and in identifying more children with lead exposure. And reasons for this include all children can be exposed to lead, so focusing on high-risk children has the potential to miss some children. Additionally, low-level non-paint sources of exposure can have a similar risk to living in old housing and may not be captured using current screening methods and assumptions. And decisions to test are left up to the provider, and there is substantial variation based on providers' knowledge, practice setting, patient demographics, and financial incentives. Universal testing presents a great opportunity to identify and provide necessary follow-up care to more children who are exposed to lead. Next slide, please. So before we go into the Q&A portion of our webinar, I want to reiterate a few key points. Children can be exposed to lead from various sources in their environments. Some are more common than others. As even small levels of lead in children's blood have been shown to adversely affect children's health, protecting children from lead exposure is important to lifelong health. And a blood lead test is the best way to identify if a child has been exposed to lead. And CDC is committed to increasing blood lead testing and awareness, and along with our federal and non-federal partners, ultimately eliminate childhood lead poisoning as a public health problem. Next, please. So for more information about everything we discussed today, please visit our website at www.cdc.gov/NCH/lead. And on our website, you can find a directory of our funded state and local programs, data and statistics, various publications and guidance documents, FAQs, laboratory guidance, and communication materials available for distribution and downloading and customizing. Next slide, please. Also, our federal partners have valuable information and resources available on their websites. Below are links to resources from our partners at HUD, EPA, NIOSH, and the Consumer Product Safety Commission, CPSC. Next slide, please. So I want to thank all of our colleagues and everyone involved in the fight against childhood lead poisoning, and we'll now open it up for the Q&A.
Thank you, Perri, and many thanks to our presenters. Again, to ask questions using Zoom, click the Q&A button at the bottom of your screen and type in your question in the Q&A box. And again, please note, we often receive questions that we may not be able to get to live during the webinar. If we do not get a chance to answer your question live, you can also submit your question at ehnexus@cdc.gov. So our first question for today is lead poisoning reversible? Madeline or Dr. Ruckart, please feel free to jump in.
Yeah, I can take this one. So while the effects of lead exposure may be permanent, if they're caught early, there are things that parents and caregivers can do to prevent further exposure and reduce damage to the child's health. So we have a webpage on our website that is entirely devoted to prevention, that provides some great tools and resources about ways that lead poisoning or lead exposure can be prevented for children. So I encourage anyone who's interested to check that page out.
Awesome, thank you. The next question is, why is lead a persistent problem? Why isn't it just banned everywhere?
I'll answer that one. So even though there have been restrictions on lead in gasoline, paint, and consumer products in the US for many decades, lead contamination still lingers, and we discussed in the presentation the various sources that are still a problem here in the US and in other countries. And for a complete list of these sources and more information, you can visit our Sources of Lead Exposure webpage.
Great, thank you. How can I find out if my water has lead in it? And if there's lead in my drinking water, what should I do about that?
Yeah, I'll take this one. Yeah, so with lead in water, your local water authority is your first source of information when it comes to the lead content of your tap water. Many public providers have data on drinking water quality, which includes lead levels as a part of their annual consumer confidence reports. And these are all available on EPA's website. So that's a good starting place to check that out. Also, many public water systems will test drinking water for residents upon request. And if they can't for some reason, they'll connect them to laboratories that are certified to test lead for water. But we have a very informative lead in drinking water webpage that provides all sorts of information about this topic. So that would be a great one to check out.
Great, thanks, Madeline. So can lead be absorbed by touching, surfaces of any material like plastic or metals that are in good condition that have been painted with lead paint?
I'll answer that. So if the lead paint is intact and remains in good condition, then the lead-based paint is not usually a hazard. However, there's potential for exposure to lead-contaminated dust if the lead-based paint starts to peel or crack, or if it's on friction surfaces such as windows, windowsills, doors, and door frames. And, because moving those around can cause the lead paint to flake off. And there's the potential for exposure during repair or renovation activities. So that's why we suggest the lead-safe renovation and repair practices.
Great, that's great to know. Is it safe for a child to shower or bathe in water that may contain lead?
Yeah, with this, so children are mainly exposed to lead through inhalation and ingestion, or swallowing and breathing. Dermal exposure or exposure through the skin is less common. So bathing and showering are safe for children. However, young children do engage in mouthing behavior as a part of their normal development. So because of this behavior, this could cause them to swallow lead contaminated water. So that's something to think about.
That's great to know. Thank you. What follow actions are recommended for children with lead in their blood?
Okay, I'll answer that. If a child has lead in their blood, a doctor may recommend actions such as finding and removing lead from the home, feeding the child a diet high in iron and calcium, and connecting the child to early educational services, as well as follow-up blood lead testing. And if a child has a blood lead level of 45 micrograms per deciliter or higher, healthcare providers may recommend other types of testing and treatment to remove some or all of the lead from the blood. This would include an X-ray to look for swallowed lead, or chelation therapy, which are medications used to remove lead from the body. But for more information on caring for children with lead in their blood, we have a whole webpage dedicated to this. It's CDC's recommended actions based on blood lead level, and it goes over everything we recommend based on the categorization of the blood lead level.
Thank you. Speaking of children, can lead affect an unborn baby during pregnancy?
Yeah, I'll take this one. The answer is yes. If a person is exposed to lead during their pregnancy, their developing baby can also be exposed. So lead in the blood during pregnancy can increase a risk of miscarriage. It can cause the baby to be born too early or too small, and it can also hurt the baby's brain, kidneys, and nervous system, and even cause the child to have learning or behavioral problems as well. So someone who is pregnant someone who is pregnant and thinks they may have been exposed to lead should talk to their healthcare provider about getting a blood test. And we have a whole webpage devoted to this as well. That's titled Pregnant Women. So that's something that also provides some valuable information on this topic.
Yes, and that is a great resource. How can lead safely be removed from a home or a building?
Mm-hmm. So lead safe certified contractors can safely renovate houses and other buildings. And the EPA's lead renovation, repair, and painting program provides steps contractors can take to safely renovate homes built before 1978. And a certified risk assessor can help decide whether abatement, which is eliminating lead hazards completely, is a better option. So again, you could just look for that resource. It's linked, EPA's resource is linked on our webpage.
Got it. Thank you. Madeline, I believe you mentioned toys during your presentation. What kind of toys contain lead, and how can I be sure if my child's toys are safe?
Yeah, that's a great question. So some imported toys, antique toys, and toy jewelry may contain lead. So the reason is because dangerous chemicals are less well regulated in many developing countries, and lead paint is still widely used in some of these countries as well. And then also there are toys made in the US before the ban on lead paint in 1978. So these are things like antique toys or collectible items that may be passed down through generations. So those kinds of toys may also contain lead. But the US Consumer Product and Safety Commission, or the CPSC as it's abbreviated, issues recalls of current products that could potentially expose children to lead. And they post regular updates about this. So on their website, you can find photos and descriptions of all sorts of recalled toys and products on their website. So that's something to definitely keep an eye on and go to if you're worried.
Great, thank you, thank you. And then Perri, in your part of the presentation, you mentioned the decline of blood lead levels. If blood lead levels have declined tremendously over the past few decades, why is there so much effort in being put into lead poisoning prevention?
Mm-hmm. Yes, it's true that the levels have declined, but still millions of children are exposed to lead in their environment through all the sources we discussed in this presentation. And there are significant disparities that exist by race and income. And it's so important to identify children who have been lead exposed and to stop and reduce exposures, because adverse health and development effects are being identified at increasingly lower blood lead levels. So even though the average blood lead levels in children have decreased substantially, lower levels of lead in the blood are now known to negatively affect a child's IQ and behavior.
Got you. Thank you, Perri. Let's see. All right, and we're going to proceed to our last slide. Unless, see, we see anything in our chat or anything that we can address. Okay. So to echo Perri's thanks earlier, thank you to all of you, from the colleagues here at within the National Center for Environmental Health and the HCA on Toxic, ATSDR. Not going to butcher that one today. And joining us in the fight to, the fight against childhood lead exposure. Next slide, please. And thank you again for joining us in today's EH Nexus webinar, with a special thanks to our presenters, Dr. Perri Ruckart and Ms. Madeline Jones. If you have any additional questions, you may email them at ehnexus@cdc.gov. Again, thank you for joining us. Happy Lead Poisoning Prevention Week, and I hope everyone has a great